So there's another type of fistula in the body known as what? The pancreatic fistula. All right, pancreatic fistula. Now, what is a fistula? Definition of a fistula is what? Abnormal communication between two epithelial surfaces. All right, so it could be that the intestines are not supposed to communicate directly with the wall of the abdomen, but the intestines are now communicating with the wall of the abdomen. So we now have what? An enterocutaneous fistula. It could be that the bladder is not supposed to communicate with the rectum, but the bladder is now communicating with the rectum directly. So we are having a what? Rectovesical fistula. Now for pancreatic fistula, we're just trying to look at the pancreas, and that's when the pancreas is abnormally communicating with what? Any structure that is around it. All right. So if there's a pancreatic fistula, what is the definition? What are the types? What are the causes? What are the symptoms? What are the diagnosis, treatment, complications, and prognosis? All right. So that's what we're trying to look at under the concept of pancreatic fistula. So let's define. We said that pancreatic fistula is an abnormal communication between what? Two epithelial surfaces. So these two epithelial surfaces, one being the pancreas now. So it's an abnormal communication between pancreas and other organs or the skin. So the other epithelial surfaces could be other organs around the pancreas, or it could be direct communication with the skin. All right. And now, if the pancreas is abnormally communicating with anything, it will now cause what? Pancreatic fluid to leak out. All right. So it is a complication of things like pancreatitis and pancreatic surgery or trauma. All right. So here's an overview of the concept. Types of these pancreatic fistula include the external pancreatic fistula, where the pancreas is now communicating with the skin to the outside. All right. It could be internal pancreatic fistula, where the connection is to any other organ around the pancreas. And the organs around the pancreas, once you use, just Google, or like you could just use your atlas to check. All right. You check around the pancreas, and any organ that is around the pancreas, there's a possibility of the pancreas abnormally communicating with this organ. All right. Causes. It could be due to pancreatitis, which could be acute or chronic. It could be due to some pancreatic surgery, so the complications. It could be due to trauma to the pancreas. It could be due to pancreatic cancer. All these are possible causes of what? Pancreatic fistula. Symptoms. The patient will complain of abdominal pain, fever, chills, nausea, and vomiting. Diagnosis. If you want to confirm, you do imaging studies like what? CT scan, MRI scan, ultrasound. You could do endoscopy. You could do what? Fistulography, where you are injecting contrast into the fistula just to what? Have a view of everything there. All right. Then treatments. You could do conservative management like what? Drainage, nutrition, and antibiotics. Then you could do endoscopic treatment. You could do surgical treatments like fistula closure or pancreatic resection. All right. Complications now. If this disease condition is actually there, it can result in some one or two complications which we'll be looking at. There could be infections, because now there's abnormal communication. So there's a presence of a wound. Microorganisms can actually go through and start colonizing. Right? There could be malnutrition. There could be what? Pancreatic insufficiency. There could be fluid and electrolyte imbalance, because the two organs will now be communicating abnormally. Abnormally in the sense that this communication is not approved by the governing body of the body. Okay. The prognosis is actually variable and is depending on the underlying cause or how fast you started the treatment. Okay. Mortality rate is about 10 to 30% depending on the severity. So I think that's it for pancreatic fistula. See you guys.